I'm Dr. Alinne Barrera, and I'm an assistant professor here at Palo Alto University. The name of my research group currently, I believe, is the Latino and Women's Health Research Group, which describes more generally the work that I'm doing. So most of my work primarily focuses on developing and implementing and then testing interventions to prevent and treat depression in underserved populations. I am interested in working currently with Spanish-speaking populations. I am bilingual, and so most of my work is in Spanish and in English, so I'm always looking for students who are bilingual and who can use those skills or who are interested in developing their clinical and research skills in these populations. So some of the work that I'm currently working on and that my students are involved on, I have two projects right now. One of them is a web-based intervention to prevent postpartum depression, and it's a pilot study, and we're looking at can we reduce the risk of depression in this web-based sample of women who are pregnant and interested in learning skills and techniques to reduce their risk. This sample is an international sample, and mostly comprised of Spanish-speaking women from Latin America, and we recently wrapped up the data collection for the primary sample that we're interested in looking at. And we'll be spending the next few months or so cleaning it and organizing it. And so students are working on that data. The other project that I have that's really starting from the ground currently is a project that was really born out of the work, the clinical work that I did at San Francisco General Hospital, where I was treating mostly Spanish-speaking women for depression and anxiety, and it became very clear that many of them also had these very complex trauma histories that weren't really at the surface of why they were presenting for treatment. And so we're working with some community clinicians to develop and test an intervention that's CBT-based, that's looking at how can we incorporate cultural concepts to help these women gain insight to their histories and how it impacts their psychological and psychosocial functioning. And so students working on that project currently are actually doing a lit search and with the goal of actually submitting a manuscript and submitting a grant so we can test it at our clinic. Students in my research group, most of them have an interest in the work that I'm doing or in some piece of it, so they have access to a large data set of web-based data that has been collected online. I also collaborate with researchers at UCSF, so there's the possibility to work there as well if you're interested in traveling and doing some of that work. Most of the students have some interest, whether that's in technology or in working with women or working with Spanish-speaking populations. I am open to working with students who have other interests, but I just find that I'm better able to mentor and to guide them if it's within my area of specialty. I do meet usually twice a month with my students, sometimes more often and individually, and I do encourage students, as long as it matches their interests, to seek out and to develop their skills as researchers. So there's plenty of opportunities to write manuscripts, present at conferences, and to look at data. And so most of my students work independently, but we also work as a team. And one of the things that I do have an expectation for my students is that they will actually come up with a project their first year that they're in the research group, which will eventually become their dissertation project. So feel free to email me if you have any questions, and I look forward to working with more students at PAU.